Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and today we're going to be talking about peak performance and how you can achieve that. Whether you're a professional football player, professional wrestler like Brooke Adams, two-time champion, by the way, in TNA wrestling, or you're a weekend warrior, you need to be able to function at your optimal level of function and performance. And we're going to show you how to do that today, utilizing chiropractic biophysics and three-dimensional adjusting. So the first thing we're going to do is we're going to check her posture. Let's go ahead and face the mirror and have her close her eyes, flex your head forward and backwards. Now see, she's got really good range of motion. And we analyze her three-dimensionally on the x-axis, the y-axis, and the z-axis. And she just got adjusted recently, so she's looking really good on her posture. Good. Now, a lot of people, especially professional athletes, get chiropractic adjustments not because they have neck pain or scoliosis or disc problems, but because they want to function at their peak level of performance and be champions. So, when I was treating NFL players, and still do treat NFL players, they got adjusted before practice, during practice, after practice, before games, during games, and after games. And of course, we always see Brooke before and after her TNA wrestling matches because we don't travel all over the country to adjust her. She's a superstar in TNA wrestling, so we want to make sure that she stays at her peak level of performance. Now you notice we have the legs parallel with the table and the floor, and we're going to wrap this towel around her neck, like she's had this move at TNA. And then I'm going to get my contact at the occiput, not the neck. And I do a straight vertical lift on the y-axis. Did you feel that all the way down?
Oh, yeah.
Very good.
Woo.
And we always check the patient's reflexes afterwards to make sure they're still kicking, which she is. Now, the most important thing for any athlete or anybody doing anything is to warm up. Perfect. I know you heard that one all the way over there. That was a chiropractic, biophysics, and Palmer diversified adjusting move on the cervical spine. That was a master rotary break. Now, she has had a few things going on with her hamstring here on this right side, so I adjust her knee and her hip joints on both sides. Excellent. And then we check her leg length, and she's a little bit short on the left one, but see, her hamstring is a lot better now than what it was when we first started. She can get it up to here, but that tightens up a lot, doesn't it? So the way we do that is now push against me. Good, now relax. We stretch that out, push again. Relax. And look at this. Now push one more time. Very good. Now look at the difference in the range of motion there. This is called therapeutic activities and therapeutic exercise. See, this hamstring's a lot looser, but we still want to do things symmetrical, which means even from side to side and front to back. Very good. Excellent. Now, just from doing that, her legs are exactly equal in the supine position. So now we're going to have her roll on her side and go lay on her tummy on this next table. And now we're going to be adjusting the X, Y, and Z axes. So her legs were even down there. They stayed even, but she's got a little bit of a sacroiliac problem right here on the right, which, by the way, coincides with this right hamstring tightness that she continues to be plagued with from an old injury. But we've had about an 80% improvement in her hamstring over the period of time. Now you can feel the belly of the muscle, and you'll see right in the belly that gets tight. So what I'm doing right now is I'm actually working on what's called the muscle spindle. It's right in the center of the belly of the muscle. And I'm actually tricking this muscle into relaxing. It's pretty painful when I'm doing it, but the muscle will actually then relax And there we go. We can just let those go. Yeah, that was tender, wasn't it? Yeah. Even if you're a professional wrestler and get thrown around the ring, some of these moves can be somewhat painful. But if you really want to achieve peak performance, you have to tune up your race car. And I always use the analogy of our bodies are our race cars. If you have normal alignment in your front end and your rear end, and you're racing your car around the track, everything runs and moves much more efficiently than it does if you have a wreck and misaligned your front end or rear end. If you drive that car around with the front end or rear end misalignment, you're going to wear and tear the parts, which are the joints, and the disc, the tires. So now what I'm going to do is move up into your upper thoracics right here. There we go. Now just let this relax for me. There. She's got some pretty tight traps here today. I'm sure she probably worked out her entire body yesterday. By the way, she works out 6 to 7 days a week. So when you're that tough on your race car and you're working out that much, you want to be functioning at optimal level. Now the nervous system controls and coordinates the function of every organ, muscle, tissue, and cell in the body. So if you have a normal nerve supply to all of these organs, muscles, tissues, and cells, they function at a higher level of efficiency. Now, we're going to check her leg length, exactly even. I bet that felt easier, didn't it?
Yeah, very loose.
Now, we're actually going to use this device called the Terminator. And I'm going to put this in her hamstring too. Yeah. There we go. See, that can be very tender, as you can see. You see, the left one's not as tender, but it's still tender. I better watch out or she'll put me in a headlock. Now see, this right one's a lot worse, isn't it? Yeah, breathe. There you go. I do this real easy here. You get up into her paraspinals. This will basically create a mild fascial relief in the soft tissues of the spine that hold the pelvis and the spine, allowing oxygen and nutrition to come into the muscle cells, but as importantly, allowing the blood flow to carry out all the metabolic waste products of normal cellular metabolism, which is what gets people so sore. And that one was a lot more sore, wasn't it?
Yeah, it's killing me.
Yep. Okay, let's turn on your back. Peak performance is all about not just physical, but mental and spiritual well-being as well. So we take care of people for, drop this right in my hand, she got one more at her atlas right there. And see her legs now, her feet are exactly straight ahead, which is where they're supposed to be. And we're going to pull this right hamstring up again. Look at the difference. Now feel easier that time? Very good. Now we're going to go ahead and sit up sideways and face the mirror. Now, because she uses her arms and shoulders a lot, I do adjust her shoulders, elbows, and wrist. Perfect. I know you probably heard that one all the way over there too. And perfect. And see, she relaxes really good for all these too, which makes it a lot easier. The more you relax, the better the adjustments work. And we adjust every joint from the head all the way down to the feet. Now, she didn't have her shoes off today, so I'm leaving her toes alone. There, good. But she used to have shoulder problems too, but that's pretty much gone away, as well as elbow problems. Good. Now let's come over here and we're going to put the final touches on with a high-velocity, low-amplitude instrument. This is a neuromuscular re-education technique, and what I'm going to be doing is adjusting the atlas on the x-axis with her body and mirror imaged posture back to normal so that we can retrain the cerebellum to hold her in place as opposed to out of place. Let's go ahead and close your eyes. Flex forward all the way. Backward and neutral. Much better. Take a look. Now, much better. So we're going to do this. We're going to have her flare her arms out like this. We're going to bring her head back just a little. Now tilt left just a tad. Adjust the atlas on the right. And now the left. And now I'm going to hit these mid-thoracic ones. Very good. Now, let's do that one more time. Flex forward all the way. Much better. Range of motion. Straight as an arrow. Professional athletes. Peak performance. This is Brooke Adams and Dr. Gregory Johnson, your Houston chiropractor. We'll see you next time.